Good evening. Tonight we're going to talk about insight-oriented therapy. An insight-oriented therapy is a classical approach to marital counseling. According to this theory, marital dysfunction is caused by recurrent relationship patterns of a partner that inaccurately represent appropriate needs, desires, beliefs, and expectations of a relationship. Usually marital problems arise in the form of alienation or some form of emotional deprivation due to these distorted desires and expectations of one or both partners in the relationship. We are now going to take a break to view an example of insight-oriented therapy and then rejoin here to look at the three different types of strategies used in insight-oriented therapy.
Hi, my name is Dr. Shay. It's good to meet you both. Can you please introduce yourself before we get into this session?
I'm Morgan Lane.
I'm Tucker Lane.
It's good to meet you. What brings you in today?
Well, we seem to be having some communication issues. He just doesn't really seem to understand that I would like to go on a vacation, as in like go somewhere. And he doesn't want to go, and he seems to just always, I don't know, like he just doesn't, he's not, you get what I'm saying?
Well, I mean, I travel a lot. I'm on the road all the time. I'm traveling all the time. It's my work, and sometimes I really just want to stay at home when I've got free time.
But I don't want to be on a staycation. I want to go on a vacation. I said I would like to go somewhere. He gets to go everywhere, and I just sit all day. I want to meet people. I want to go places.
Where do you want to go?
I don't know. Like, where have we gone? We've gone to Disney World. Wasn't that fun?
We waited in lines the whole time. I didn't want to go on a vacation where I just stand around. I mean,
well, you decided to go on a vacation at a time where there was a lot of people. If we had went in the winter, when like no one was in line, we wouldn't have had to wait in line.
well, that's when I have to work. I don't get to choose.
You work too much. You work too much.
It's my job. It's what I have to do. It's what makes money.
Well, and that's why I spend it. If you're gonna work all the time, then I'm just gonna spend your money.
Well, that's not how it's supposed to work.
But you get what I'm saying? I would like to go somewhere. I would like to take some time off from work and go somewhere. And he just doesn't want to cooperate and be a part of it.
Well, I just can't deal with the busyness of all these people. I'm always meeting new people. I just sometimes want to.
So I get to be nobody because you get to meet people all the time? That's not fair. I would like to meet people. I would like to go places. Do you know that he went to San Francisco, but it was a job? So while he was working, I had to sit in a hotel room and do nothing. That's not a vacation. That's not what I wanted.
Well, I don't think you would have enjoyed the seminar. It wasn't terribly exciting. It was a work trip. It wasn't a real vacation.
Right, but we were supposed to go on a vacation.
We went on a weekend trip earlier that month.
And then what? Worked. You worked. No, I would like to spend money and go on a vacation.
Well, I try to take you where I can go, but I mean, I can't go that many places. I mean, I'm all around these states here.
You know what? It's kind of like that time. For instance, we were supposed to go on vacation to Canada, and we should have bought this place. It was a really nice house. And he didn't want to buy the house because, you know, we couldn't afford it at the time. He just had to work more. And now look at it. Now we have nowhere to go. It could have been like our resort home, our home away from home. And now we don't even have that.
It would have been nice to buy that house, but it's very expensive. It's buying a whole another home.
But you work all the time. So if you're working all the time, that means we have money, which means that we could have afforded the house.
We don't have that much money. I mean, it's not, you know, cash doesn't grow on trees. Someone's got to earn it.
Well, you are, which is the reason why I want to spend it. You know what? Why can't we do something like, well, I don't want to go to Kentucky and visit your family. What's
wrong with my family?
Well, there's nothing wrong with your family, but if I'm trying to get away, that includes your family. Like, vacations are away from everything.
You still haven't told me where you want to go.
Well, anywhere that's not here. Like, we haven't even been, like, really? Your phone? Really? We're in a session and you're going to be on your phone?
I have to.
Oh, is this work again? Really? You see what I'm talking about? All he does is work. All he does is work. You see that?
I have conferences. I got to be in touch. I can't just lose touch, otherwise I'll lose my job. And then we can't go anywhere.
We don't go anywhere now.
Probing is a technique used by therapists to help discover underlying issues. A therapist will use questions or statements aimed at arousing certain feelings or beliefs in one or both of the patients. This may take multiple sessions to achieve, and as the therapist uncovers more intimate details about a patient, there will probably be more questions to be asked. The therapist essentially needs to learn as much about the couple individually and as an entity so that they can break down the problematic situations and identify possible sources.
The therapist uses these techniques to encourage the client to express deeper feelings that they may not have been aware of before, or to come to grips with emotions that they've had.
Okay, Mrs. Lane, I just wanted to get you alone a little bit to talk to you a little bit about your family life. What was your family life like as you were growing up?
Like my dad, I love my dad. He gave me the world, but he was like never home because all he did was work. But, he made sure that we would take our family vacations together and just spend the quality time with each other like that we could.
Good. So tell me how you feel about your relationship.
I love Tucker. I really do. I love that man. It's just, he never wants to go anywhere or do anything. That's not the man I met, and it's very frustrating.
Yeah, I see how that could be frustrating. Okay, and what makes you the most unhappy about your relationship?
I think the spark isn't there anymore. Just being able to go somewhere and get away from working. I don't think that you should have to work all day, every day, and work yourself to death. But, I think that's the thing. It seems like his job comes before me.
Yeah, that must be very hurtful. Okay, and how do you feel about your job?
It's a 9 to 5. I go in, I do my hours, and I get out, and that's all there is to it. I'm not staying. I don't do overtime. I don't have my life to just sit away at a desk and just keep working. That's not part of my lifestyle.
Hello, Mr. Lane. I just wanted to take this opportunity to get to know you better. Can you tell me about your family life as you were growing up?
Well, my parents didn't have too much money. We got to go places a lot, but money was tight, and I always had a job. Ever since I was a kid, I was always working a lot.
Tell me about your job right now.
I'm in sales, so, I'm wherever they need me to go. I'm pretty much all around the country. I drive a lot.
So it requires a lot of traveling.
Yeah, definitely on the road, spend a lot of nights in hotels, and I know I'm not as home as much as Morgan would like, but it's the job, it's what it takes.
Yeah, that could be very stressful. Okay, do you feel satisfied in your relationship?
It's been a rough few months. We definitely can't agree on just about anything anymore, especially where we want to go in our free time. I'm always so tired for being on the road, and I'm always so worn out. I just want to stay in my own bed, but she just can't wait to get out of there. So it's hard for me to come home sometimes. I feel really stressed about it.
Yeah, it's okay to feel that way sometimes.
Affective reconstruction is very similar to cognitive reconstruction, except that it focuses more on the resulting physical emotions that drive a person's actions rather than just the mental or cognitive aspect. Affective reconstruction is the process in which a therapist identifies for each partner the pattern of maladaptive behaviors and coping methods across relationships that is causing their current problems with each other.
Thank you guys for coming back today. Now that I've had the chance to talk to you both together and separately, I was hoping to take this opportunity to hopefully get you guys to see where each other's coming from. First, I'd like to start with Morgan.
Okay.
I've had the chance to talk with Tucker, and I'm sure you know that Tucker didn't grow up in a similar situation as you, and he's always had a job. Right, Tucker?
Yeah, ever since I was a kid.
Yeah, so he's always had to work for his money. So Morgan, I'm sure you can understand that Tucker's mindset towards money isn't the same as yours. Can you get that?
Yeah, I get it. I do.
On the other hand, Tucker, I think, are you willing to sacrifice a little bit of money and time to just go on a couple vacations a year?
Yeah, I think it would be good to get out of the house for a bit. I would like to plan some time away.
I think you and I have both learned over these sessions that quality time is very important to Morgan, and that getting away is something that she's very interested in. So I think maybe if you are able to just take your schedule and clear off a week or two where it's no work and just you guys can go somewhere together and enjoy each other.
Yeah, I think I can get some time off. I think it would be really fun.
And in return, I will try to take more consideration motivation that we can do things that don't require as much money and have more downtime so that she can get the rest that she needs.
That would make me feel better.
Thank you so much, Dr. Shea.
You're welcome.
Thank you, Doctor.
It was great to meet you guys.